Assalamu alaikum wa rahmatullahi wa barakatuh. In this lecture, I am talking about the humerus. The humerus is the longest bone in the upper limb. It's articulate with the scapula at the shoulder joint and radius and ulna at the elbow joint. In the model, I am seeing the humerus bone. This is a humerus bone. It has two ends, proximal end, distal end, and shaft in between. Firstly, I am talking about the proximal end. In the proximal end, I am seeing the head of a humerus. This is head of a humerus. Is oriented medially, superiorly, and slightly posteriorly. The head of a humerus is articulate with the scapula as the shoulder joint. In the lateral part of the proximal end, I am seeing the greater tubercle. This is greater tubercle. It's rough elevation. While anteriorly, I am seeing elevation is named lesser tubercle. This is lesser tubercle. Between the greater and lesser tubercle, I am seeing a groove named bicipital groove. This is bicipital groove. In this groove pass tendon of long head of biceps muscle. Below the head or behind the head, I am seeing between the head and the tubercle, I am seeing the anatomical neck. This is anatomical neck. While below the head and the tubercle, I am seeing narrow area is named surgical neck. Is the common site of a fracture in the humerus bone. Now I am talking about the shaft of a humerus. This is shaft of a humerus. In the midpoint of the shaft, and I am seeing deltoid tuberosity is occur in the anterior lateral surface. This is deltoid tuberosity. It's part of insertion of deltoid muscle. While in the posterior surface, from posterior to the lateral surface, I am seeing the spiral groove, the shallow groove. This is a spiral groove. Is relation of the radial nerve and bronchondabrachii artery. This is spiral groove. And the fracture in the spiral groove will cause injury in the radial nerve. In the distal end of the shaft, I am seeing the lateral and medial supracondylar ridge. This is lateral and this is medial supracondylar ridge. Now I am talking about the distal end. This is distal end of a humerus. In the distal end, I am seeing the medial and lateral epicondyle. And the medial epicondyle is larger and can easily palpated. In the posterior surface of the medial epicondyle, I am seeing sulcus for ulnar nerve is named ulnar sulcus or ulnar groove, is pass of the ulnar nerve, and the fracture of the medial epicondyle will cause injury in the ulnar nerve. While in the lateral is a small projection is named lateral epicondyle. In the condyle of the distal end, I am seeing medially in the medial condyle trochleae. This is a trochleae of a humerus. Is articulate with the ulnar notch. While in the lateral condyle, I am seeing rounded smooth elevation is named capitellum. This is capitellum. In the distal end, I am seeing 3 fossae. Number 1, coronoid fossa. This is coronoid fossa, is occur above of a trochleae. Number 2, radial fossa. This is radial fossa, is occur above the capitellum. These 2 fossae occur anterior surface of the distal end, while in the posterior surface of the distal end I am seeing 1 large fossa is named olecranon fossa. This is olecranon fossa. Thank you.